Because it's so complementary, we're going to move on to the next panel, which will bring forward a number of faith-based organizations who work closely with religious institutions and congregational networks to improve WASH. And I'm going to call my colleague Michelle forward. And Michelle, if you'd like to bring your panelists to the fore as well. The panel will explore the critical contributions of faith-based organizations in advancing WASH and highlight progress and measurable impact to date. We'll have examples of the established work along with new commitments. Come forward and please be seated. And there will be an opportunity for some inputs from the room at the end of this session as well. It's my pleasure to introduce my friend, my colleague, Michelle Weimer, who is a partner at the Kyle House Group and who has been, like so many of the other folks that you've met, a member of the organizing team for this work for many years. Michelle, the floor is yours. Thank you.
Well, it is such an honor and a privilege to be here. I can't believe how much we have discussed in the last 2 days. My notebook is overflowing, and I think my heart might be at the same pace. What I have learned in the last 2 days is that faith-based organizations really have moved the dial. They've moved the needle in every aspect of life, of every aspect of development, and the moral call to do more continues to exist, and it grows stronger. And by design, we see that here in this room. Faith-based organizations represent one of the largest service delivery networks in the world. They number in the hundreds of thousands globally. And as we know well, in many countries, they operate a significant share of healthcare facilities, making them indispensable to advancing WASH at the point of care. There are millions of NGOs operating globally, but conservative estimates imply that 1/3 of those are faith-based. And in the context of poverty reduction, it's nearly half. So again, I think there's been a dialogue miscommunication for several years. Faith-based organizations, as my new friend Isabel said, were once placed at the kids' table. They were seen as something that wasn't indispensable in evidence and wasn't indispensable as experts, but more of a nice thing to have. I think where we're seeing a real difference is that this is where the expertise lies. So it is my great pleasure to introduce a host of the frontline implementers, to introduce the people that are working around the globe, implementing these programs, yes, on behalf of their beliefs, and yes, on behalf of the God they serve, but really as experts in the field. So I'm going to ask first, we've had a new panelist join us, Didane Arama, from Caritas Mali. If you would please lead us off in telling us about you, your organization, and your work, and then we'll go to the rest of the panelists. That would be wonderful.
Bonjour à toutes et à tous. Je suis Dieudonné Arama de la...
Buonasera, rappresento Caritas Mali. A Mali. I represent Caritas Mali in Mali. Caritas Mali has been working in the WASH sector with the CRS, Catholic Relief Service, and Caritas Internationalis, in view to improve WASH conditions in healthcare facilities. We have 5 healthcare centers in the diocese with which we work on an ordinary basis on WASH. Our work allowed us to build for these healthcare facilities some burners, incinerators for waste, biomedical waste management, and also to build toilets and bathrooms, and also some installations for hand washing, and also to provide water through drillings that have been performed for water real-time provisioning. This has been done to provide fresh water to the 5 centers all at the same time. These wash services are working right now the way we wanted and play an important role in improving the health quality in these 5 centers. As for sustainability, as an action plan, we started with training and capacity building activities of the medical staff. We have been strengthening their basic know-how and knowledge of WASH, and we have also been accompanied by François Cangelat. This was very important. He's here present as a WASH CRS technical expert who left the Republic of Congo to come to Mali to support us in this effort. And he was also accompanied by a regional healthcare representative of Mopti, and this allowed us to train the staff, medical and non-medical staff, dealing with hygiene in our 5 healthcare centers. So the capacities, the skills of these persons were strengthened in order for them to perform better work. We have also helped the teams of these centers to work on sustainability. So each center drafted an action plan by themselves specifically, and right now they are implementing this. Then we have also been working to establish management protocols for WASH with instruments that allow us to perform assessment and monitoring of progress in real time. We also introduced a data collection system for WASH, allowing us to evaluate also progress we are making. Furthermore, we invited all centers to allocate a budget line for WASH. So still working in sustainability, this is what the Diocesan Caritas did to support these different healthcare centers we have today that are working the way we wanted, despite we know very well the political and social situation is not the best one. Thank you.
Didone, thank you so much. Now I want to turn to my colleague, Barrick, who is here to represent 2 organizations. He's going to talk first about the Accord Network, which all of these members are a part of, and then we will loop back to him where he will discuss the organization that he actually works for. Barrick, thank you.
Wonderful. Thank you, Michelle. So it's fantastic to be here today. I am here representing Accord, one of 2 hats, and on behalf of Michael Cerna, who's the executive director of the Accord Network, and unfortunately was not able to be here today, but he sends his greetings and just deep appreciation for this event and the different voices that are contributing to the amazing conversation happening here today, and also tasked me with taking copious notes on his behalf and bringing back a report for him. So the Accord Network is a coalition of roughly 160 Christian relief and development organizations who are working together to serve vulnerable communities globally. It was founded nearly 50 years ago and really organized around the belief that we could serve more effectively if we were working together rather than in isolation. So today, the Accord Network functions very much as a platform for collaboration, and it brings organizations together for shared learning, to strengthen practice, and increasingly to partner on complex challenges like the one that we are talking about today. So one of the ways that this happens is through the Accord Alliance's communities, through the Accord Network's alliances and communities of practice. So these are spaces where practitioners from different organizations will come together around specific disciplines. So it could be around finance, it could be around marketing, a plethora of program sectors that we all work in. And currently we have roughly around 14 communities of practice operating at the Accord Network. So it's a really robust group of professionals across disciplines, varied experiences, and working internationally in different contexts. So the WASH Alliance is one of Accord's longest running communities of practice. It was actually launched back in 2012. And it draws currently from roughly 24 WASH-focused or WASH-adjacent organizations across the network. And these organizations are working on safe water systems, sanitation and hygiene, engineering, monitoring and evaluation, health systems, community-based programs, and represent a collective footprint of around 100 different countries of operations. So the WASH Alliance brings practitioners together and strengthens practice, worked diligently to develop a set of shared standards of excellence that we as WASH organizations would aspire to and rally around. And as WASH and healthcare facilities is being elevated as a greater area of focus, the WASH Alliance offers an important platform, a valuable platform for learning, advocacy, and collaboration. So beyond collaboration and learning together, many Accord members are also involved in advocacy, different types of advocacy, but also advocacy around WASH in the United States. For years, members have joined peers in educating U.S. Congress and U.S. administrations about the priority of WASH in U.S. foreign assistance. Recently, Accord has worked behind the scenes to advocate for WASH programming as part of U.S. global assistance, and that's actually resulted and reflected in a recent spending bill from U.S. Congress, where they affirmed their commitment to fund Water for the World Act. So overall, Accord has played an incredibly valuable role in strengthening the voice and efforts of faith-based organizations globally across numerous sectors, not just WASH and healthcare. And I'm pleased to say we have a number of Accord member organizations represented here today, many of them on this panel, and we're honored and excited to be a part of the conversation here today. So thank you very much.
Thank you, Barrick. Next, we're going to turn to my colleague Louise from International Care Ministries.
Good afternoon, everybody, by 8 minutes. My name is Louise Joachimowski, and I think that Dr. Ronald probably has the #1 unpronounceable surname, but I'm a close second here with my husband, Michał. Our last name is pronounced Joachimowski, if you care to try it. Michelle, I noted that you did not attempt it.
Nope. 14 years and still can't do it.
My mom's about the same as well. So I serve as the executive director for International Care Ministries. ICM is an organization which is laser focused on serving the ultra poor. And so the ultra poor are those in last mile communities, and by default are just really out of the reach of a lot of the healthcare that we've been talking about today. We target people who live on 50 US cents per person per day, and so that's about 1/6 of the level of extreme poverty. And so we're really looking at the very, very bottom of the economic ladder. And ICM, we're all about operating efficiently and at scale. So we currently in the Philippines, where we started and we've worked for 35 years, we have a network of 20,000 local pastors who tend to be in very, very, very small churches. We've seen the opposite of their churches here in Rome. These are tiny churches, often 40 to 50 people. And so we work in the southern two-thirds of the Philippines primarily. And so, for us, thinking about scale, building healthcare facilities is an expensive endeavor for an organization of our size and budget. That would not be a possibility. So instead at ICM, we focus on scalable solutions. So we've developed a holistic education and graduation program that we call Transform. And through the local church partners, which includes a strong element of WASH education and a little bit of resource provision, we've now served 2 million people through that Transform program. We also have 1,500 community health champions who are serving 150,000 Filipinos with ongoing healthcare. I'm being told to slow down. Sorry, ladies, I've got so much good stuff to say. My boss will be proud. He's a notorious fast speaker. We have 1,500 community health champions who are volunteers who serve 150,000 Filipinos with ongoing healthcare services, and we do that for $20 per person served. So that being said, that's our historical approach to health programming. But the reason that Michelle's kindly invited me to speak today is that ICM has launched an ambitious project to scale some fixed and mobile clinics which have the potential to enroll 1 million Filipinos into the Philippine government's universal healthcare. So the Philippines is actually quite interesting because the government is well-resourced. They've raised lots of money through tax and they're having trouble spending it. And the way that that's happened is because the Philippines is very decentralized and not very developed in terms of its health facilities. And so the poorest Filipinos have no idea that the Philippine government has 100% enrollment target for people to be on universal healthcare, because often they're in the furthest places, they don't know that this program exists, and the costs of accessing are very, very high. And so at ICM, we've really just started in this space. We've launched 2 brick-and-mortar clinics in central hubs in second-tier cities. They have full WASH facilities, which we're proud to say, but we're looking to scale up to 40 fixed clinics. But the exciting and the real impact for the poorest people will be that each of those fixed clinics has a mobile clinic which is attached to it. And these are vans which are fully equipped with diagnostic and some pharmaceutical, and they will drive up to where the people don't have healthcare. And so it'll be a one-stop shop to enroll, to diagnose, and then to treat basic healthcare issues. And so just last week, I was on an island where we had to drive for a couple of hours. We had to get onto a ferry, a little pump boat, go across, and then we had to drive on a motorcycle for some time. And there was, this isn't connected with this health clinic, but this was a TB screening clinic, and they had bought an X-ray machine, they had bought sputum sampling tests, and it was amazing just to see 150 people who would never have gone to a clinic being diagnosed with TB and being treated right there on the spot. So the most exciting part of this project for ICM is that we are projecting that this could be a net profit undertaking, which, I mean, anyone who's working in this space, that's a thumbs up, right? Yes. So the Philippine government is saying that they'll actually pay $30 per patient enrolled and served. And so once ICM can scale this, we forecast that we could actually generate sizable profits within the next 18 months, and we'll use those profits then to fund the other healthcare work that we're doing. And so once we get to scale, we actually see this could be a wonderful model. And so I think WASH in mobile clinics where you don't have running water is a challenge, and so one of the things that ICM is committed to is being innovative in how to just figure out how to serve our patients best, but do it at scale. So thank you very much.
Thank you. All right, next we have Jason Peters from Amazi Water.
It's a delight to be here and to be with this august assembly of global WASH experts and leaders, and I'm thankful for the Vatican's dicastery for the promotion of integral human development. Thank you for the invitation to be here. It's so exciting to think about the implications of the work that happens through these organizations. And we've been able to see several partners here, World Vision, of course, and the Tear Fund coming up. Catholic Relief Services in Burundi has been very effective. So thank you for that. Thanks to all of you for your support. I wanted to say last week I was in hospital, and it was interesting because I wasn't there for myself. I was there to welcome my newest granddaughter. And it was interesting when I couldn't help but get the picture out of my mind. I have 5 children, and the oldest has now, her and her husband have 3 children. I couldn't help, the picture in my mind was of a woman in Burundi who is literally counseled, when you come for your delivery, please bring 2 jerry cans, 20 liters each, for your water needs while you're delivering your child. It was sobering. And I know some of you have seen that in various places around the world. And so about 11 years ago, the founders of Amazi Water decided to try to tackle the biggest problem in arguably one of the most challenging contexts in the world. And it's gone quite well. We thank God for the success thus far. We have been able to complete 1,122 water systems, many of them solar powered, some with battery backups. And they're remarkable. These are they're small municipal level type systems. And so it's been a joy to be able to be a part of that, to see it happen. We have a very ambitious goal as well. Our goal is to bring water, clean water, safe, reliable water to the entire country of Burundi within a 20-minute walk of every community by the year 2030. And we're on our way. We're on our way. We're about 30% of the way there now. And what Michelle asked us to specifically highlight for our organization is the governmental relationships that we have. It's remarkable. We could not do what we've been able to do without the strong patronage of the Burundian government. And while, of course, we're apolitical, we're there because we're the hands and feet of Jesus in Burundi, but we have found great favor with the government. In fact, you might be surprised to know that we've arranged all sorts of interesting customs agreements and importing tax-free fuel, which if you've been to Burundi, you know that's quite the challenge. We're the only organization that they've done that for, so it's quite a bit of favor. And I'll even share that the government of Burundi has given us cash, similar to your idea, to implement these water systems. So we have a very, very good relationship throughout the country. We're targeting the entire country, and so we're able to work unhindered in any part of the country without a lot of red tape or bureaucracy now. And so I would just encourage, where possible, and I'd love to chat with you about this, build strong relationships with the national leaders. It's easier in a small country. Burundi is not very large, so we do have a fantastic personal relationships with the president and down from there. But when possible, it's a wonderful way to advance the mission. I think that's about all I would share this morning. Are we going to talk about what's coming up? Is that another round? Okay, excellent. I'll share more when I have time. So thank you so much.
Great. And now we're going to go to Jason Chambers from EMI.
Yeah, another Jason. Yeah, so I'm with Engineering Ministries International. Our mission is to develop people, design structures, and construct facilities which serve communities in the church. And we do this in a lot of different ways with engineers and architects, construction managers, but we're more than just engineers, as our name suggests. We are, as I mentioned in our mission statement about developing people, that's where we start. We want to develop people as a beginning of human dignity, and as something as we look in the design profession itself, being able to improve the quality of things that are designed and constructed around the world, but also as we learn from learn ourselves from those that we engage with in local industry, local design professionals and construction industry. And so where this fits into healthcare facilities, we do a lot of partnerships directly with healthcare facilities, and a lot of that with hospitals. Where we help come alongside them, and the beginning of that is listening to their vision for the health of their communities and understanding what challenges they're facing in providing that health care. A lot of times WASH is one of those needs. It's going to be something that we see within healthcare facilities, but often we find that their greatest felt need is something something other than WASH. It's often where they're trying to combat clinical issues that they're facing, and that's what's right in front of them that they are struggling to be able to meet. And so as we come in as engineers and architects and having some amount of expertise in the healthcare sector, we can help validate those concerns that they're having and help speak into those things. But we can also bring alongside all of the support services that are needed to help with the work that they're doing. They can't operate without WASH. They can't operate without electrical systems and power. Those things have to be there for a functioning hospital to work. And so we want to make sure that as we are working with their greatest felt needs, those clinical needs that they're facing every day, that we're also bringing in those support structures to be able to support what they're doing and to strengthen the systems around that. A recent example of a project that we're working on now is in Zambia, in the Eastern Province at Minga Mission Hospital. They're a Catholic hospital, and we're currently finishing up construction on a new surgery facility, site infrastructure for water and electrical, oxygen plant. There's so many things that are going into this facility. It's brought the attention of the Ministry of Health and where we've developed an MOU with the Ministry of Health to then partner with them to provide a strategy for the entire Eastern Province and looking at all the needs of their district level hospital specifically, and be able to help them prioritize and strategize how they can meet those. Because when we come into a single facility and a partnership, it's overwhelming. But when you start looking at the needs of a region and a country, it can be quite overwhelming. And so we have the opportunity there to partner with the Ministry of Health, and it's been a great opportunity to also partner with other organizations. Living Water, which Beric will speak to later, is he's also they're involved in this strategy as well. And so it's a good opportunity for us not to just engage in single facility improvements, but also look at the broader network of healthcare needs within the region. And that's been a huge success that we're excited to see kind of finishing through and launching into what's next. So.
Thank you. Great. Next, we turn to Parvin Ingala from World Vision.
Thank you, Michelle. And again, a big appreciation just to be part of this important forum and with the other panelists on this session. I wanted to start with a story. Just over 50 years ago, there's a woman carried into a hospital, in a public hospital in Kenya. And she was in distress and needed help, not yet at 40 weeks in pregnancy, and was at risk of losing her child. After weeks, she was able to leave the hospital with her child. She decided to name the child after the doctor who attended to her during the pregnancy, or at least during the delivery. The name of the doctor was Dr. Parvin, an Indian doctor. That's why yours truly is called Parvin. And that was my mom. And that's the why for me. That's the why of why we are this topic really matters to us. There are very many my moms around the world. There are very many me's who would not have made it to be part of these discussions. I wanted to share that because at the moment, I'm privileged to work with World Vision, where our focus is on children. And in fact, we have a statement, a mission statement that says, for every child, life in all its fullness. We currently work in just around 100 countries across the globe. In terms of WASH programming, we are in 59 countries across the different regions. And WASH in healthcare facilities is one of our important priorities. We've been privileged over the last couple of years. We started around 2016, substantively working in WASH in healthcare facilities. And as part of that, we've been able to support over 5,600 schools. Yeah, you can say schools is also an agenda for me. Healthcare facilities to be able to access water, 3,000 to be able to access sanitation, and around 10,000 to also reach or at least have hygiene services. So this is something really important to us as an organization and a priority as we talk about our WASH strategy. One of the things I just wanted to highlight, and Michelle had requested, what are some of the things that you're doing that are beyond the infrastructure, in our different organizations? So a couple of things. One, we very much are involved in training healthcare workers as we talk about, access to hygiene and making sure that that is actually part of the IPC frameworks. We work with UNICEF, WHO on the WASH-Fit framework, looking at how we improve it across our programs, but also how we are accountable for what we are doing. The other thing that we are doing as an organization, we've extended to also have WASH and energy. Many, and I do remember the examples that were being shared, in terms of the places where we work are hard to reach. There are places where there's no incentive for politicians to invest, So, and energy is one of the things that we see as a challenge. So we, as an organization, as we talk about access to WASH in those areas, we are also looking at access to energy. I will say that the other bit, and again, data, I know we said we're not talking about numbers, but data is important to us. So with our WASH programming, what we currently do for every country where we work, we are, as much as possible, mapping the infrastructure on M-water system, and if talking about over 40 countries where we work in this regard, we are mapping that data, and that includes 4 WASH in healthcare facilities. We think this is important data. I do remember I was talking to Rory from UNC. That data is going to be what helps us actually say, look, what is the evidence that we have in terms of what's working and what might we need to adapt or change? So we are also working in terms of evidence building and looking at how we improve upon what we're doing in terms of WASH in healthcare facilities. So those are some of the things that I just wanted to highlight in terms of the priorities that we have for World Vision insofar as WASH in healthcare facilities. We have an ambitious target, and everybody's talking about ambition in this room. For this new, our current WASH strategy goes up to 2030. Globally, we are targeting to reach 20 million people with safe water and sanitation and hygiene, and specifically looking at over 3,000 healthcare facilities being able to access safe water, sanitation, and hygiene. I will say, we can't do this alone. Yeah. I love the phrase, we are stronger together. It's about every person in this room, and I feel, as we talk about faith-based organizations, as we talk about faith leaders, as we talk about partner organizations, that we are only able to do this because of the partners that are in the room and that we work with. So thank you.
Yes.
Thank you so much, Parvin. And back down on his dual-hattedness, we're back to Barrick to talk about Living Water International.
The introvert to have the microphone 2 times. So, this whole topic of WASH and health facilities really hits home for me in so many different ways. I think we all have a little bit of a why story behind why we're here, why we do this work, why we believe what we believe and are invested in the ways that we are. And a little bit of my why behind this is my parents are medical missionaries. And so I actually grew up in rural health facilities in Sierra Leone and in Papua New Guinea in the days long before the internet was a thing. And so seeing that of course, really impacted my worldview. And I've spent the last 20 years working primarily in the WASH sector, but also taking some side quests, as we all do, into different areas and working for many years at the intersection of WASH and HIV care for people living with HIV, and then also working with an organization in East Africa doing a social enterprise model of healthcare, and really seeing firsthand the impact that water in health facilities has. So these conversations really touch, I think, a deep part of my heart, and recognizing that healthcare not only reaches people who are often the most vulnerable, but they're reaching and serving those people at a point in their life when they are feeling most vulnerable because of illness, because of treatment needs, maybe a mother delivering a child. And so this is a really critical point where we can bring safe water to those types of individuals. So I'm really excited to be here and hearing all of the great work that's taking place. I work for Living Water International, and as you can tell from the name, we're a faith-based WASH implementing organization. And I love the question earlier today, or yesterday rather, who do you serve? And if you were to ask team members in our organization, they might say we serve the thirsty. And so I think that's a big piece of our heart, is being able to serve the thirsty globally. So we just celebrated 35 years as an organization last year, and over the course of that time have been able to serve around 7 million people with safe water and sustainable WASH services. Our current footprint is in 14 countries across Latin America and the Caribbean, all over sub-Saharan Africa, East, West, and Southern Africa, and then also in India. And our core model is really built around 4 driving strategies. One is a geographic focus within countries. So we work in what we call a WASH program area model. And our goal within that WASH program area is to maximize WASH coverage over a course of 5 to 7 years. And so we want to see transformation of that region so that we are able to track and monitor health indicators, behavior change, conduct system strengthening with local actors. And that's our second key focus area, is around strengthening local actors. So we work with national and local government bodies, not only in the process of designing, but even selecting the locations that we are going to work in. The buy-in of local leaders is critical to the work that we do, and that will include church leadership from national and local levels, civil society organizations, as well as community leaders. We really want to focus on WASH for all. And so in the design of our program areas, we look at communities, we look at schools, we look at churches, and we look at health facilities. And our desire is to really build out a strong program over the course of time that addresses each of those different institutions. And then finally, we have a missional focus on the local church. We work through what we call the Flourish model, which is empowering the local church to be actors within their communities, empowering WASH transformation. And as we all know, the church is very much embedded within the social fabric of communities. And they play a critical role in community level advocacy, behavior change, and sustainability. At a larger level, we've talked a lot about partnership, and partnership is something that Living Water does really well, and we're really excited about. Just to kind of put some tangibility to that, to the different types of partnerships that we have. We're working in Kenya with Cross Catholic Outreach and with Caritas on a WASH program area in the Laikipia region. It's a multi-year engagement and really focus on supporting Catholic-run churches and the areas, the communities and the schools and the health facilities that they are serving within the Laikipia region. We have a similar partnership in Latin America with a group called Light a Single Candle. And we've been able to partner a program with them that we call our Saturate model, focusing on leveraging human-centered design principles in our work. We've talked a lot about principles of participation and listening and local engagement, and we've really found that leveraging human-centered design in our work provides a tool set that our teams can really lay a hold of and be able to engage effectively with different stakeholders in the design process. We've been working with Compassion International in a few different countries, most recently in Uganda and Zambia, and being able to partner with them in their frontline churches. And of course, Compassion is a child-focused organization, but children don't thrive if they don't have safe water. And so looking not just at the frontline church partner that Compassion is working with, but also partnering with the surrounding community, schools, and health facilities where those children are present. And so that's been a really powerful relationship. And then, of course, Jason mentioned our work with EMI, and that's extended over the years in different ways. So we're really excited about the partnerships that we have. If we would love more partnerships. If you're an organization that is working in this space and is interested in partnership, please reach out to me. Thanks.
Thank you. All right, I was going to do a lightning round of questions, but actually, I want to give the mic to you. I've heard feedback from the room that the best part of the day is really when we're engaging together. So let's ask questions together, and then we'll go break bread. Sister Teresa?
Thank you so much. I'm Zachary from Compassion International. Thank you so much to the panel for the great discussion. I have a question around collaboration and system strengthening, but I do need to give a little bit of context before I ask my question, because I think we like to joke that Compassion is one of the largest NGOs that nobody knows about. So let me just set some context really quickly. Compassion is an organization committed to partnerships, very much like Living Water. Partnerships with local community actors and other NGOs that align with and advance our strategic goals of seeing children and youth in poverty achieve transformational outcomes. And we do that working alongside about 2.3 million children and youth annually across 29 countries. Through a budget of about $1.3 billion, of which none of that is GIK, that is nearly 100% privately funded. Despite historically being nearly 100% privately funded, we're strategically diversifying our portfolio right now by pursuing institutional partnerships for really the first time in our 70-plus year history. As mentioned, a critical component of Compassion's programming is operating at the community level. We do this through partnerships with nearly 10,000 local churches. And therefore, we have a unique channel to identify needs and gaps and solicit local ownership of programs. Compassion also utilizes key partnerships with NGOs and INGOs through what we call strategic alliances, to address the needs identified by local church partners where compassion doesn't have the expertise to meet the need. Our view is that partnering with churches and other NGOs strengthens compassion's ability to address system and community level challenges. So compassion is not specifically focused on WASH and healthcare facilities. However, we have vested interest in systems strengthening in the context where we operate. So my question is, how would you recommend someone like Compassion, who doesn't work in WASH in healthcare facilities, to best show up in this space as a contributor and collaborator to promote system strengthening and community development? Also, if our community here in this room has ideas, please reach out, as we'd love to explore collaboration too. Thanks.
Does anyone have an answer to that? Unoma? Okay.
Hi, I'm Tina with One to Water, and I think I do have a suggestion, but building also off of comments. I think for waterborne disease, as important as the healthcare facility is, prevention is actually the #1 way to provide health care for waterborne diseases. So I was really excited to hear the models that engage the community, and it sounds like several people are already involved in that. And I think that would be one of my suggestions as a small NGO operating across several continents, really looking at how do we prevent at the household level waterborne diseases, because then we're actually reducing the burden on the healthcare facility, who is probably also lacking, as we all know, solid WASH infrastructure. So I think looking at household solutions, and that's a challenge I kind of feel in relation to how do we articulate call to action that was mentioned earlier, is if we can collectively articulate the prevention and the infrastructure improvement. All of us have a lot of expertise in this room, a lot of systems, a lot of great networks, but increasing the resources, we really haven't dove into how do we do that, and where can we find that in this time when we all know we're facing decreased resources. So super excited to really talk to other people about how do we increase the resource for what we need to do at the household level so children actually have clean, safe water, sanitation and hygiene at home, in their school, and in their healthcare facility.
First, I want to say thank you to everyone who shared today. I can see there's so much compassion and just pride in what we do. So to answer the question in the most honest way, I think one of the ways to do that is to speak to more than like maybe 5 or 6 people here, because I feel like a lot of people have talked about what you just mentioned, strengthening capacity and working in other spaces outside of healthcare. So taking someone's number or email and connecting with them outside of this, because we have 2 days and we are supposed to talk for 1 minute and we talk for 5 minutes. So taking time outside of this meeting to talk one-on-one, like having like coffee chat or Zoom chat, like actively talking and working towards the plan is the only like way to do this. Like we all want to do the same thing, but actively taking that action and meeting outside of this, to me, I think is the answer.
Thank you.
Okay, I had a question to respond to what Peter said, wherever Peter is, in his talking. It always startles me, it's not the first time I heard it, is that a lot of our wonderful faith-based facilities are not the highest quality facilities, which we all go in to do the highest quality. But then I also know I've heard many, many people say they go, like our sisters go, to where no one else will go. So you're going to a place that you got to dig like hundreds of yards down to get water. And so people are doing the best that they can. And as we prepared for this meeting, one of the slogans said, if you don't have water, you don't have health care. And I shrugged because it's like, at least they got something. So I'd like a response to that high-quality nursing in me saying, if you're not going to do it right, don't do it at all, to you got to start somewhere with baby steps in the reality if we're going to go to where no one goes. And so if someone could solve that problem for me, it'd be wonderful.
Thank you, sister. I think I totally agree with you, and ICM faces a lot of this tension in our work is, you know, the question of do you go deep versus do you go wide? And I think we've found it our calling to say we're going wide and we're going to do a little bit for the most number of people as possible. And I think that's an approach which is difficult, right? Because you see and you struggle with the fact that I go into communities all the time and I say, I wish we could have done more for you, but that's because you're in front of me, right? But I know that there are the 2 million and the more that are coming who we haven't been able to reach yet, or we've been able to do a little bit for. And so that's definitely a tension. And I think Lisa and I were just talking a little bit earlier about one of the beautiful gifts of the church, though, is the fact that many of our organizations have had to face cuts in the last couple of years. And it's been really painful. And I think we can all sit and feel with that. But Lisa and I were saying that many of us have said, well, we've had to stop paying people, but those people have not stopped working. And isn't that just the most amazing thing about the church, the network of the church, that people, even if we don't pay them, are still coming and being community health champions and doing the work. And that was a challenge to me. Like, if I wasn't paid, would I still do this work? I don't know. Would you do your work if you weren't paid? It's a challenge, right? And so I think that's one of the miracles of the church network, is that, you know, people who are underpaid or not paid still show up, because we see this not as work but as a calling. So thank you.
Could I just add to that? In our experience with different healthcare facilities, when we come in, we see often that there's so many different needs, and the people that are working in these facilities are doing the best they can with what they have, and it's commendable. I like to encourage them in the work that they're doing, because they are making a difference, even if it's not, you know, the top of the line facility, top of the line healthcare that they could provide. They're doing what they can with the resources they have, and it would be nice to come into a facility every time and be able to say, well, we can do all these different things, and if you're connecting to funding that can do those things, I'd like to talk to you about that, but that's not the reality for most facilities, that they've got to incrementally work their way up and to be able to do what they can with the limited resources they have in the most remote and places serving the most vulnerable people. And that's just the reality. And so a lot of times I recommend being able to make small improvements in what you're doing, and it may not be getting you to the level where you want to be, but there's a pathway to get there, and there's ways that we can make incremental improvements that provide a little bit better and a little bit better, and it's, you know, as the engineer in me kind of, you know, really doesn't like that we can't get them all the way there at once, but it's also something that's the reality of the world we live in, and that the resources aren't always there.
I'm just going to add to that, because so I've been working in the WASH sector for around 25 years, and one of the things I see in terms of how we articulate what WASH is, you know, sometimes it's just about making sure people have access to drinking water. Yeah. So as World Vision, our current strategy on WASH is, the title is Mapping the Blue Thread. And the issue about this is, how do we make those connections to what water does in a community? Yeah. How do you package that in a way that people then understand, look, we're not just talking about water for drinking. We're talking about water that actually also makes a difference in terms of livelihoods. We're talking about water that also makes a difference in terms of education. You had my bleep about schools, yeah? And I think that's really part of what we are trying to do, especially to all the donors in the room and also online, that we want to make those connections, that it is crucial to those connections, and that the investment then, that's where the return on investment is. It's not just about the basics in terms of drinking water or sanitation and hygiene, but actually about what else it does. So maybe that's one way also of looking at it in terms of how we articulate the value that access to wash does in healthcare facilities.
Do we have time for one more?
Thank you very much. I know that some of the things that we're talking about now will be picked up a little bit later in additional sessions today, but I wanted to make a comment which I hope does not sound crass or cold in its approach. But there is a point in all of these conferences and meetings of this sort where we reach the stage where we say, well, we all have the warm heart for the issue, but there's just insufficient resources. I'm not so sure that we're entirely accurate in the way that we present that. The fact of the matter is that if we are articulating our value sufficiently to the communities in which we are working, including the national, the ministries and the national, the representative governments, et cetera, it is in their interest to support us. We need to make them understand that it is in their interest to support us. Similarly, the faith-based communities are not without resources. And they are the ones who are saying, this goes to our core, this is our mission, this is what we live to represent. And I believe that that is the case. Therefore, we need to help the faith communities to take ownership of these issues as priorities with respect to their own missions. And so the more we are doing, the more we show that we are serving those whose communities will benefit the most, I think we will free resources, at least in the sense of readjusting some of the priorities toward our interests as well as the many other interests that they serve. I know that's a challenge, and I know that we're all trying to do it. But I would rather us not just simply say there's limited resources that we're just spreading among one another. The reality is our recipients should not be seeing us as the outside source of assistance. They should be taking ownership at the same time, and I think we can help them to do that. My apology for the cold moment.
Okay, final word, Jason.
Yeah, thanks. It's interesting when you talk about ownership, that's something we've integrated in our model, and I know we all tried to do this. One thing that we've done is we're completely integrated vertically as an implementer. So we have the hydrogeologists, the construction crews, the fabricators, we have our own pump truck, drill trucks, we have everything. So we literally do it all in-house, except we do not do any trenching, and we do massive projects. We just completed this week a 13-mile, 22 kilometers of trenching for a neighborhood with 172 taps. We didn't finish all the taps yet. We just finished the trenching. But I say we don't do it. The community does it, and that's the beautiful point. In fact, I don't want to go into too many details, but in this situation, there was a bit of a question. Do we really have to do this? This is 22 kilometers we have to dig. And we said, you don't have to do it because we can go to a different community, but if you'd like us to be here, then that's the deal. And it just creates a ton of ownership. Thanks. That's a wonderful point. Thank you so much.
Steve? Okay, Jean, do we have time for one more?
Oh.
Good?
Okay, hi. Steve Warner. I've been up a couple of times, so representing Rotary, but I'm a WASH consultant. I'd like to respond to the question from Compassion, colleague from Colorado also. So, Peter, would you hold up your hand? Peter. Brima, hold up your hand. Nancy. Ryan. Higher, Ryan. Higher, Ryan. And Krista, wherever Krista is, she's been up here also. We're not the only ones. We're not the only people who have been in this sector a long time, but there's a program that deals with post-construction support to projects, and we know that many projects fail. And they don't fail because of bad intentions. We're all trying to do the best work we can, but we're not embedded in communities, most of us here in this room, all the time. So communities need a continual support residual training, things like that. So if you want to seek out one of us to learn about a program called Circuit Riders, you might hear about it in the next session. But we can also help you connect to people that can help you design programs well and then follow them up really well. And going back to Sister Teresa's comment, just want to remind everybody that the road to the trip to Rome starts with a single step, right? So going back to the point, we have to start somewhere. But we can be learning organizations so that we learn from our failures on how to do the work even better next time. Don't give up.
Yeah, there's a lot of passion in here, and even a newcomer would feel it if he came within the building. And I've been following the proceedings very attentively. I'm Henry from Zambia, working for Access to Health Zambia and a member of CMMB. And I bring greetings from Mama Mary Beth, our CEO and president, who could have loved to be here. However, a few points, and I know they've been echoed out, but it doesn't really hurt to re-echo in a different angle. And I want to agree with you, Jason, that working in Africa, sometimes it could be tough because if you're not careful, you might be seen to be decampaigning the current government or regime, and you could be going nowhere in your programming. And so being said is that there's one word that I've learned with time that in this time now there's a little resources to implement programming. There's a new currency called partnership. And partnership, when you coordinate it very well, it reduces duplication of work, and it avoids to scatter around the little resources that we have. So I encourage this house to not to dash out and run away after our meeting, but to hang around, exchange cards, emails, and continue chatting so that we can not go back home and duplicate, because sometimes I've noticed, especially when I was doing HIV programming, you'll be 7 of you, different organizations, testing the same people. And I don't know whether we came out with the right data representing the positives and the negatives. But I want to believe that if we went ahead and coordinated very well, we are going to have authenticated detail and data of how many people probably will be in need of ARVs or any other thing. So I'm encouraging this house that we go on that one. The second point I have is when we are designing these programs, normally I've noticed they fail because we design them from a conference room or a boardroom somewhere, and hoping that when we go with our document, people will be willing, or the community will be willing to champion that agenda with us. It's our agenda, by the way, because we're in the corner and they're not agreeing with what you are thinking is a problem. So in the design process, at the very beginning, when we are doing our baseline entry, let's involve them. I mean, I want to agree with you. We did a program in Mwandi, a southwestern province of our country, which is a very hard area to reach and access, and CMMB working together. We've done a lot of good WASH work down there. And it's amazing, and I'm inviting most of you to come down to Zambia and see what we've done in that corner of this world. And we are serving numerous numbers of women and our sisters that to access clean and safe drinking water, and and much of it, we worked with a very little amount of money. Very little, because the drainages and the pipes, 5 kilometers radius to different direction, were done by the local community members. And then to respond to Father's question to say, who owns that? You won't ask that question when from the very start the people are engaged, because they will actually even protect the property from vandalism. So for me, I'm encouraging that we don't need to design these programs in the conference room or in the workshops. Let's go back to the community and go engage the community leaders. As in Africa, our systems are literally controlled and based traditionally. And traditional leaders, once they speak, they've got more power than politicians that we go and vote in the ballot box. So let's engage the community, let's engage the original people, and all our programming will be actually propelled in the right direction with very affordable amount of resources. Thank you so much.
One more. Yes.
Malik Keita from Global Water Challenge. I just want to share a couple of thoughts and also maybe a question for the panelists here. I really enjoyed this session and learning about the work that each of your respective organizations do. In terms of comment regarding Sister Teresa's comment, I think that it's been well said. The road to Rome starts with one step. We cannot let the perfect be the enemy of the good. So what you are doing already is absolutely commendable. And you are moving the needle regardless of what is being said outside. I just wanted to say that. And then another comment that the prior intervention noted as well is I think that there is an elephant in the room that is government. What we are doing in the WASH sector right now, from my personal point of view, is the mandate of government. So all the work that you are all doing, that we are all doing, we are actually doing the work partly their job, really. So one thing from my experience in the WASH sector for 16 years now is that it also links a lot to government accountability. We know that it's hard sometimes to get them engaged, to get them to put funding toward WASH, to have policies in place for universal access to WASH or for enforcing the policies. Some might have universal access to WASH in the law, but may not enforce it or actually work towards that. So one of the thoughts that, one of the questions I have, you know, maybe it's going to be an opportunity to discuss it. I know we're running out of time right now in the next session this afternoon, is what effective models or approaches have you seen from your experience where communities are supported or educated in holding government accountable? I would be very curious to hear perspectives on that, because in my view, this is something very critical to lead to policy change, policy enforcement, government commitment, government funding, and so on. So, thank you.
Thank you. You just do Colin one last, yeah, last word from Colin. Last word from Colin. And a brief word, if you please. Last word here. And thank you for that very good point. We'll certainly want to pick that up again in the afternoon. Thank you very much.
Thank you. Thank you. Okay, to be brief, in my experience over the many years, I find that WASH in healthcare facilities, everyone, and I'm not minimizing or prioritizing these, but I'm saying everyone pretty much recognizes the need for water. Everyone pretty much recognizes the need for toilets and in many cases, bathing shelters. But we've heard from a few people today. Dieudonne mentioned earlier, I think Joanne and certainly Francoise yesterday, about medical waste management side of things. And so I have a concern that there's a bit of a gap there for those NGOs. I mean, I'm representing World Relief just now with supporting 130 healthcare centres and some nutrition centres as well. And certainly within what I've seen with this and many other organisations is some of the medical waste management is provided in some cases not. But what isn't provided is there's a gap
because the technical wash people do what they do best, which tends to be the construction and installation. And the healthcare people do what they do best. Doctors, nurses, but I feel like there could be a gap in the training for the healthcare facility staff in management of medical waste management side of things. So it's a gap that I wanted to sort of flag, and if anyone would like to talk to me about training for that, I would be very much willing to hear your thoughts on that. Thank you, that's my point.
Great. Thank you all so much.